My name is Taylor Elder. We'll be going over the SOT for Category 1. I got my patient here, Corey. And first thing we're going to go over is the prone leg length analysis. So I'll get you lie on your stomach facing the hole. Okay, for SOT's leg length analysis, you grasp the lateral aspects of the ankle, and can I get you to press out in my hands? Hold for 3 seconds to release. Go and check for the lateral malleolysis, see which one is superior. See that his right is more superior than his left, and also go through and check for not heel tension, but check for the Achilles on him is wider on the right side. That's common with his short leg. And we go right into just the heel tension. With the webs in my hand, I grasp the back side of his heel and dorsiflex. You can do it bilaterally. You can do it one at a time. You can do it with both hands one at a time. You're just feeling for tension kicking back as you're dorsiflexing, and I feel it more so on his right than I do on his left, and that's also common with a right short leg. And after the heel tension, we'll go straight into figuring out his majors for his crest and dollar, left and right side. The way you figure out for a major for a crest sign, come about the L4 level, get your fingers for the Davis classification here, and squeeze the erectors, lateral to medial. You can see that his right side is more taut, fatter compared to the left, so he has a major crest sign on the right. And for the dollar, come down to his PSISs, go down 2 inches and go out 3, and you're pressing T to A, feeling for squishy and tone and lack thereof. Okay, and I feel it more so. I feel lack of tone on the left compared to his right, so he has a major dollar sign on the left. And from that, we'll go into just the normal short leg blocking for Category 1. So if we don't have any blocks, I'm going to go into, we're going to use shoes. Earlier he had a right short leg. I'm going to block 45 degrees up on the greater trochanter of his short leg. Do you have any problems with his knee? Okay. Come up. Just going to rotate. Right there. Bring him back. Any problem with this knee? Nope. Good. Here, and then block 45 degrees down at the ASIS. Right there. And as we have them block, the patient's just laying there trying to relax. I keep checking his leg length for it to change, for the legs to even out. And we can hold them in this position up to 10 minutes, but just keep checking it for it to get better. And from here, let's go on to the crest and dollar adjustments. Earlier, he had a major crest sign on the right. He has a major crest sign on the right. We're going to do the crest roll on the right side. Go to the iliac crest here and roll off, and go to the opposite side and do an ish tube toggle around the ish tube, and then adjusting for the dollar on the major side. You had a major dollar on the left. It's a glute scoop on the left, and then a PSIS clockwise toggle on the right side. And then from here, with him still blocked, we're going to check for the sacral base analysis for SOT. Exposed to the L5 spinous, hold your thumb there, instruct the patient to take a deep cough. Okay, I can see and feel that my hand, my thumb went straight up superior. That's indicative of a sacral base positive. If my hand went straight towards his head, that would be a sacral base negative, and it was a combination of the two. It's sacral base neutral. For him, sacral base positive, we're going to take out this block, roll it out, and then we're going to, get your leg back up here again. We're going to block it also 45 degrees down. And from this position, since it was a sacral base positive, I'm going to be applying pressure to the apex as the patient takes a deep breath in. I want you to take a deep breath in, okay, and let it out. Let off on exhalation. in on inspiration, out on exhalation. This is supposed to pump the CSF flow from the sacrum all the way up to the spinal cord to the occiput. Okay, just do that a couple times. And if you had sacral base negative, I would just change the blocks out, have them going 45 degrees up. If it was neutral, then I would have the blocks pretty much neutral at 180 degrees from each other, straight across. And for the neutral, I would apply pressure on inspiration and on the base during exhalation, getting a proper pumping motion throughout the CSF. The last thing we got here is a trap fiber analysis. Remove the blocks on the side. Trap fiber analysis goes along with 7 zones along the trap. The first one is about the V of the AC joint, and the 7th is at the lateral aspect of the T1 spinous. And you have 4 right in the middle, and then 2 and 3, 5 and 6. And you just palpate, apply pressure at these spots, and the patient will let you know if there's going to be a tender spot there, and whichever is more tender is the zone you go after. There's 1, 2, 3, 4. It's tender there. Okay. Do it on the other side also. But just for some safe time, just stay on this side. So zone 4, that correlates with the cervicals as the 4th cervical vertebra, thoracics as T6, the 6th thoracic vertebra, and also as the lumbar as the 2nd lumbar vertebra. And to figure out which one is the primary, you palpate the spinuses at C4 and T6, and you go off of the patient's tenderness, which one is more painful. Which one's more painful here, the cervical or this guy? T6. That guy? Okay, and then you go down to the L2 and do the same thing. Wrong way. Okay, which one's more tender? This one or this guy? Okay, so his most tender spot out of all those 3 ranges is T6. And to finish up this, we're going to adjust T6 spinous in a mainly superior, slightly pede knife edge contact. Tissue pull in the direction of correction. Get on your knife edge contact. Take a nice stabilized hand contact and just nice I to S thrust. And this should clear up the trap fiber tenderness in that area. And the last thing we got here is the vasomotor response. This is pretty cool. It goes along with the zones of the trap fiber analysis. And for him to go with him, the same thing as did earlier, T6 correlates along with the zones to C4. And the way we do a vasomotor response is we palpate the articular pillar aspect, lateral aspect of the C4 vertebra as we're on the spinous process of T6. And at the T6 area, we're just going to pump it inferior to superior on the spinous until we start getting a vasomotor response underneath my superior hand, which will be clammy, start sweating, you'll feel it. And it doesn't take too long. I'm already feeling underneath my hand right here. And once you get to that point, you'll come back here to the T6 or the vertebrae in question, take a knife edge contact, back it up, same, mainly superior I to S vector with slight pede. And then that clears up the vasomotor response, and that's Cat 1 from SOT.